We are at the University Medical Center in Utrecht in the Netherlands, and we're talking to oncologist Dr. Miriam Koopman. She's been one of the primary investigators of the Cairo 3 study. Final results of this study have already been presented at the general meeting of the ASCO in Chicago last month. And we are wondering if she would talk to us about the background and the results of the study. First of all, what was the reason you started this study?
Well, the optimal duration of chemotherapy plus targeted agents in metastatic colorectal cancer patients is unknown. We know that many patients prefer drug holidays. So the aim of the Cairo 3 study was to investigate the efficacy of maintenance treatment versus observation in patients with metastatic colorectal cancer.
And the endpoints of this study, what did you use to find what you were looking for?
Yes, well, for the design of the study, patients who had 6 cycles of Capox-B with stable disease or better could be randomized in the Cairo 3 study versus for observation versus maintenance treatment with capecitabine plus bevacizumab. Upon the first progression, PFS1, the secondary endpoint of the study, Capox-B had to be reintroduced. The second progression-free survival, the PFS2, was the primary endpoint of the study. For those patients in whom Capox-B could not be reintroduced, PFS1 was considered to be equal to PFS2, and that was used for PFS2 according to the protocol. An alternative endpoint was the TT2PD, the time to second progression of disease, which was defined as the second progression upon any treatment given after PFS1.
Now, for those of us who've already been at ASCO, they could have learned from the details and the results of the study from you already, but could you summarize the results for us again?
Yes, well, I think the explanation of the different endpoints is very difficult, so I think people should really look at the presentation of ASCO and look at the final paper. But what we found is that there was a significant benefit for patients in the maintenance treatment. As for the primary endpoint, the PFS2, with a difference of 1.2 months, for the TT2PD with a difference of even 5 months, and for the median overall survival with a difference of 3.5 months. So patients in the maintenance treatment arm had significantly better results compared to the patients in the observation treatment arm.
Was it something you expected already, or is it a new finding for you?
Well, I think this is the first study which investigated this really relevant question for patients, and I think it's also very important to know what the difference for quality of life results for the patients is in the observation versus maintenance treatment arm. And we are waiting for those results, and I expect them at the end of this year. Also for other subgroup analysis, because I think we are really challenged to look for those subgroups who even benefit more of maintenance treatment, and maybe we also find some subgroups who are also benefiting from observation treatment. And also for those results at the end of this year, I hope to have the final paper.
So these results are really very relevant to patients. Of course, I know any benefit in terms of progression-free survival is relevant to the patient, but these are really big results.
Yeah, I think these results are really relevant for those patients with stable disease or better after 6 cycles of Capox-B.
Now I think that the general practice is already that you are giving maintenance therapy according to the Dutch guidelines. The relevance of this study is, in my view, that you are confirming what you are already using in practice.
Yes.
So this means that this will be a continuation of what you are doing already?
Yes, this is the first study who confirms the national guidelines, in which is stated that we should continue treatment until toxicity or progression of disease.
And the additional data that you will, or some of your colleagues will be presenting at one of the next meetings and will be publishing, those will give a better detail about which patients will benefit most from this
subgroup analysis and the quality of life data.
Okay, yes. Thank you. Is there anything you would like to add at the end of these questions?
Well, I think what I also realized in Chicago, that I think in the Netherlands we should be really proud to have a network as the Dutch Colorectal Cancer Group, in which over 70 hospitals in the Netherlands participated in the Cairo 3 study, and I think that's a wonderful result, and it shows how the collaboration and the multidisciplinary collaboration in the Netherlands works. So that's
Okay. Thank you. Good luck with your next studies, and I think so.